Well, kia ora and good afternoon, everybody. It is great to be here at your annual conference, and I'd just like to acknowledge Hein as your president, and also, I believe, the newest life member of ASMS, Dr. David Jones, has been inducted over the course of the conference, so congratulations to him as well. It was really good to talk to quite a number of you last night, including three of my old medical school classmates, so it was a great warm-up to what I think will have been some very stimulating conversations that you've had today, and I've seen some of the press releases, so looking forward to having a good discussion. It's been quite a week here actually in Wellington, but also from here south right through down to Christchurch pretty much. So I've been in Kokura this morning, took a flight down with the RNZAF on one of the $100 million NH90 helicopters, and got to have a look at the devastation actually as we came into Kokura. So, you know, all the pictures that you've seen on TV, I mean, you know, they're bad enough, but when you see it firsthand, it's really quite incredible. So you see those land slips onto the road north of Kokura. I just don't know how they're going to reinstate a road there, and certainly with the rail track, that's going to be interesting as well. But we will reinstate transport links, but there's no question it's going to be quite a challenge. So as soon as I got there, I went up to the Kokura Medical Centre, and it was actually a bit like half of ASMS were there. Actually, one of the first people I saw was Dr. Alistair Humphrey. So he is there in his capacity as Medical Officer of Health, come up from Christchurch to oversee the public health aspects. And Martin London, who I know has been an attendee at these conferences at the past, was there as well. So Kokura is about 4,000 people. It's got a GP-run hospital, 24 beds, 2 full-time GPs. But quite fortunately, there were a lot of doctors in town, so a number of holidaying doctors, and it was all hands to the pump. So they coped pretty well on the clinical front. The hospital was full at the time. It's not now. But what they're facing now is, as we saw with the Christchurch earthquakes, the psychosocial effects, and that's going to go on for a long, long time. So I think it's going to be quite a long road back, and we're very clear that we're going to support the people down there with all the services that they need. And I spoke to one of the psychologists that had come up from Christchurch. They're certainly seeing, you know, quite a few distressed people, and one of the things actually that was quite noticeable and all the staff did raise was that although they've coped on the clinical side, they're pretty exhausted. So anyway, they have done very, very well. So obviously earthquakes in a physical sense, but this year we've had one or two political earthquakes around the planet, and no doubt that's been alluded to here during your conference. I mean, we had Brexit back in May, which no one was really totally predicting. And then, of course, last week's election result in the US, fewer people again were predicting. So it's been a bad year for the political pollsters. And it sort of really has made people wonder what's going on in the world and whether that could ever transfer here. So it's interesting to think about that. Sometimes overseas trends do come here, sometimes they don't. When you think about it, while New Zealand was voting for Helen Clark, Australia was voting for John Howard, while people here were voting in John Key, in Australia they were voting for Kevin Rudd. So nothing necessarily equates, but I think as politicians, you know, people in my job, we've got to be very aware of what the sentiment is out there on any given issue. And I think one of the best quotes I heard about the US election was, while a lot of Americans didn't like the messenger, so they weren't very keen on Donald Trump, the message clearly resonated with a large group of people, and that was not picked up by the pollsters or the media. So that was quite noticeable. But in the end, with that election, it was a very low turnout election. And if you look at it, Trump did worse than Mitt Romney had done in 2012, but the problem for the Democrats was Hillary Clinton did even worse. And essentially, the Democrats just failed to turn out their vote. So they didn't do as well with the African American and Latino voters they should have, and they just couldn't inspire people to turn out and get behind the campaign. So that's been pretty interesting. But I think these events give us some context against which to measure New Zealand's place in the world on a number of fronts. And, it's been a pretty uncertain world since 2008, but here we have managed to lift ourselves well out of the GFC, the global financial crisis, and we are now in a very good position economically. So back in 2008, the government's books changed from a situation where we were roughly balancing income expenditure to then losing $18 billion in revenue around the time of the GFC and subsequently with the Christchurch earthquakes. And as a result of that, rather than cut spending and go into an austerity program, as happened in most Western democracies, we continued to make sure that we supported services here, we supported entitlements for the least well-off New Zealanders, and to do that, we had to borrow money. But at the same time, we were implementing a strategy to get ourselves back into surplus. And there was a lot of debate around that plan at the time, but overall it has worked. So we are now one of the very few OECD countries to be living within our means. And basically, if you look at the growth rates projected for the next 4 years, growth rates between 3.5%, that is the envy of most economies around the world. So although there's always a lot to debate in New Zealand, when you look at that wider context, that is going to provide us with some options in the longer run. Last year, total Crown revenue was $98 billion and expenses were $95.5 billion. So for the first time in 8 years, we now have that surplus position, which presents us with some options. Of course, the events of the last week has seen an erosion of that position to a certain degree, and as the Prime Minister said on Monday, this is going to cost billions to fix. But overall, we're on the right track in terms of being able to accumulate further surpluses, which start to give us those choices around where we spend the money. And, the options are really around investment in social services, so health and the education system, or giving people back some of their own money. So that is going to be a fundamental discussion for the government around the cabinet table, and I'm sure you will have some views on it. In terms of the international perspective, we're getting good feedback in terms of the ratings of our economy, but also actually ratings of our health system. So I met with KPMG's global healthcare team on Monday night, and the head of healthcare is here in New Zealand. They're trying to sell us something. I don't think we'll be buying it, but they do actually see a lot of health systems around the world. And the comment they had was, look, you have got a very high-performing health system in New Zealand. You've got a great story to tell, especially around the integration between primary and secondary care. But if anything, I think on the international stage, we probably tend to hide our light behind a bushel a bit. But I think that is an interesting backdrop for the discussions that you may be having here. We've got an economy in a strong position, much stronger than other Western nations, and we've got a highly ranked health system. And I would say that that is a team effort, and in no small part due to the efforts of you as senior clinicians and the leadership that you are showing across the health sector. So I wouldn't pretend we're going to agree on absolutely everything all the time, but I do totally acknowledge that senior hospital clinicians are really helping us drive the health service forward, and I want to thank you for that. I think we've made some really good progress this year in a number of key areas. So when I spoke to you last year, we were working on the New Zealand Health Strategy, and we launched that in April. So that now gives a very clear strategic direction to the sector, outlining what we're trying to achieve and the shape of the health system and how we're going to have a sustainable health system into the future that delivers for the wider community. We also had a very good budget, so we secured $568 million, which is the largest amount for 7 years, and that gives us some real choices. So it means we're able to fund a range of new initiatives, and very importantly, it enables us to keep up with the latest developments and provide the type of treatments that New Zealanders expect and, quite frankly, ethically, a government should be able to provide. So we've been able to widen access to medicines. We're rolling out a national bowel screening program, which I think is very important. That's going to save a huge number of lives. And we have a raft of mental health initiatives which we want to develop, as well as make progress on the childhood obesity plan and continue to deliver uplifts in specialist appointments and further delivery of more elective surgery. So overall, I think the picture's not too bad. But I think if we're going to continue to succeed, it's extremely important that we have clinicians leading. And once again, this would be an area where people may have a range of views, but what I think we do need to do in the long term, in fact, quicker than the long term, is develop a culture where young consultants, in the age 35 to the late 40s, see it as part of their role to step up into management roles, to lead departments, rather than people thinking, oh, it's my turn now, I suppose I better do it. We really do need clinicians to be at the forefront of some of the decision making. This is better in some DHBs than others, but I'm actively now thinking of ways in which we can encourage people to take on more of these management roles and give some real meaning to clinical engagement. And I'm hoping that you are going to welcome that. I know that the SMO collective agreement is currently under negotiation, and very keen for both sides to maintain a constructive approach throughout the process. In terms of your junior colleagues in the RMO negotiations, I'm telling both parties, both the DHBs and the RDA, we want them to get around the table and to settle this issue, and it's very good actually that the strike notice has been lifted. I think the DHBs are making a pretty good and reasonable offer, and I'm very hopeful that we can get this settled, and I'm sure that will make your lives a bit easier as well. It's been quite a year for industrial action and discussions. So at the moment, one of the other key things I'm working on is the resolution of the Terra Nova case, whereby we've got 55,000 of the lowest paid New Zealanders working in aged care and the home care and support sector, who, as a result of the pay equity case, which was taken by the SWFU on behalf of a lady called Christine Bartlett, has resulted in a reinterpretation of the Equal Pay Act. So we're just working through the negotiations around that now. So we are very keen to see that progressed as well. So district health boards invest significantly in our specialist workforce, and there's been continued engagement on workforce capacity issues, and of course particularly as part of your MECA negotiations. I'm aware that many of you have raised workforce conditions as an issue, and there was a national forum on fatigue that was held earlier this year. Since 2000, the average hours of work for specialists, as self-reported to the Medical Council, has declined slightly over time, although I fully accept that that might not feel like reality to many of you. The total number of specialists working across the public and private system throughout the country has increased by nearly 80% since the year 2000, and that's around 5.5 times the increase in New Zealand's population over the same period. Since 2008, the number of full-time equivalent specialists in district health boards has increased by over 1,100, and the DHB employed specialist workforce is currently increasing at the rate of about 140 per year. DHBs are committed to being less reliant on overseas recruitment, and that's achieved in part by an increase in the number of funded places for medical students and in the numbers of RMOs. But of course, that takes quite some years before it shows results at the level that you are working at. We're very reliant, of course, in your leadership and guidance in the training of RMOs, because they are going to be our future specialist workforce. I just want to reiterate, though, that health funding is our number one funding priority as a government, and I know you will have had some discussions about this today, and I have read Hein's views on the matter, but that's okay. Yeah, we always can have some friendly exchanges on this, Hein. Budget 2016 delivered $2.2 billion over the next 4 years for a range of new initiatives and to meet cost pressures and population growth. So this year we're spending $16.1 billion on health, and that is nearly 1 in 5 of every dollar that the government expends. So claims that health funding has been cut are actually incorrect. This year, New Zealand is forecast to spend over 6% of GDP on health. Prior to that, the percentage of the economy or GDP spent on health was under 6% under the last government. So we're now actually spending more proportionately on health than our predecessors did. And over the last year, health funding has kept up with demographic pressures and inflation. We've also been more focused on the delivery of results, ensuring that people have more access to services on a continuous and ongoing basis. But like many other countries, we're facing challenges, and you'll be very familiar with these. More people are living for longer, there's a growing burden of long-term conditions, and we need to keep up with new technology and expensive drugs. We've also got to do more to address health outcomes for some populations within the country, noticeably our Māori and Pacifica populations, also those with mental health conditions and those living with disabilities. So to successfully deliver on the health aspirations of the country, you've got to have a clear direction for the system, and that has to be supported by an appropriate level of funding. So one of the first things I did as Minister of Health was ask officials to get to work on that health strategy, which, as I said, we released in April. That covers 5 essential themes: people-powered, closer to home, value and high performance, working as one team, and a smart system. And those 5 themes signal a focus on prevention and well-being and a greater degree of integration right across the system. At the same time, we want to see more support for innovation, better collaboration, and new ways of working so that we can reach the most vulnerable New Zealanders. We want to give every child in New Zealand a healthy start, and we want to ensure that information and services are more accessible. There are national programs underway to implement that strategy. Some are in the early stages of planning, but others are already making a difference. For example, the National Telehealth Service, about which I'll talk shortly. There's also been an increasing number of examples of local innovation. At Counties Manukau DHB, they've introduced a comprehensive health service at local high schools. At Papakura High School, they're bringing together general practice, mental health services, and a youth worker to address the needs of the student population. As a government, if we're going to achieve better health outcomes, we've got to have greater collaboration across social sector agencies, particularly if we're going to support the most vulnerable New Zealanders. It's crucial to get a better understanding of people with complex needs and to build services around them rather than just to dictate what they will receive. We know that these aren't easy issues to solve. It's clear that further and ongoing change in models of care is needed, and continuing to work across the social sector in a collaborative way is vital to that. I've also been focused on continuing the momentum of delivering better health services through our district health boards. And next week, I'm going to be announcing the new district health board chairs and the 76 board appointees. And that's quite a process. It's much more involved than I'd ever imagined. I've had one guy in my office working on it pretty much full-time for quite a number of weeks. But what you are going to see, and that's exemplified by the announcement today in Auckland, is a far greater number of cross-appointments, and we're trying to develop greater cohesion and consistency across the system, and also encourage better working across the regional groupings. So today we've announced that Lester Levy will be chairing all 3 of the Auckland DHBs, so Auckland, Waitemata and Counties Manukau. And the aim of that is, with a population of about 1.6 million people in the region, we want to have a better approach to planning future facilities. We want to have better operation of the existing services that we do have. And I think actually bringing it together under a person of Lester's skill and experience, you're going to see some real change in the delivery of services. And many of you will know Lester. I think he's exactly the right person to deliver the change that we need. But this is a long-term structural change to governance in Auckland. So, when Lester eventually moves on to other things in some years to come, we want to have the same position held by one individual. So I think that is going to be a very popular and I hope well-received development. In terms of priorities overall, politically it's very important for a Minister of Health that we're getting more access to more services for more people and that they're delivered closer to home. Integrated primary and secondary care with appropriate links to the social sector is absolutely vital. We've also got to continue to focus on prevention and early intervention. I'm very interested to see that the childhood obesity plan is delivered on. And I'll just remind you that we're one of the first countries in the OECD to have a target and an evidence-based plan to back it up. We've been making good progress since introducing the plan in October of 2015. For example, 219 decile 1 to 4 schools have signed up to the Health Promoting Schools program, and that's 46% above the target. Food and beverage industry groups have also committed to developing solutions to reduce childhood obesity through an industry-wide pledge. We've discussed the position on sugar tax previously, but as I said last year, it's not something we're actively considering, but we will continue to keep a watching brief on emerging evidence, and there are 2 global studies which are going to report at the end of 2017. The health targets continue to be a priority, and they're not just about the numbers, they're about delivering better and quicker access to important health services. Mental health is top of my list, and mental health and addiction services need to be able to respond to the greatly increasing demand we're seeing across the country. That demand has increased from 2.3% of the population a decade ago to 3.5% of the population last year. So to put that in real terms, for secondary mental health services, they're now dealing with 164,000 people, up from 96,000. That is a big increase. So we've increased mental health and addiction services from 1.1 billion in 2008 to 1.4 billion last year. But I fully acknowledge there's always more that we can do, and I've got officials working on a plan now to improve mental health services. And I think one of the key things really is going to be increasing access to services at a much earlier stage in the community. We put in $12 million of funding in the last budget, and that is centred on improving that early access. As I said before, Budget 2016, there's also $124 million going to Farmax to widen access to medicines. Farmax budget is now at a record $850 million, and that's gone up $200 million over 8 years. So as a result of that Farmax funding, this year they announced 2 new packages which include widened access to HPV and varicella vaccinations. They also announced 2 new medicines for hepatitis C, of course the much publicised treatment for advanced melanoma, and there's also treatments for menopausal women. That debate we had earlier in the year, and it went back as far as late last year around funding for Keytruda, will not be the last of that type of debate because the science is increasing exponentially. And the plus side is there's more and more that we can do for patients, but the issue is going to be how we are going to be able to fund those treatments. And many of you will be aware there was a major campaign just a few weeks ago around new medications for women with metastatic breast disease. So, this is going to be the start of many such public debates. There's also, as I mentioned, that $39 million for the rollout of the bowel screening program, and preparations are well underway to roll that out in Hutt Valley DHB and the Wairarapa in 2017, followed by a progressive national rollout over the following 2 years. Once fully implemented, that screening program is going to screen 700,000 people every 2 years, and it's estimated that that will detect an extra 700 cancers per year. No doubt, I know you've talked about elective surgery today. In the budget, we put in an extra $96 million to provide more of that. There's growing pressure, of course, for more elective surgery, and the only answer to that is to do more, and that's what we're focused on delivering. 1 in 10 New Zealanders received a first specialist assessment in 2015-16. So that's around 550,000 patients, a rise of almost 10,000 on the previous year, and an increase of around 119,000 patients per year over the last 8 years. In 2015-16, 171,000 patients received elective surgery, and that's more than 53,000 surgeries than in the corresponding year 8 years ago. That's a 45% rise. So that is once again a big lift. but I accept there's continuing to be more to do, and that's why we are driving for that annual uplift of 4,000 cases, which we're exceeding each year. Now, I know you've spoken about ophthalmology today, and that is a good example of growing demand in an area where patients are really demanding services. But that needs to be seen also in the wider context of the availability of new treatments, including Avastin injections for macular degeneration. While the majority of DHBs have largely been managing their waiting lists well, there's no doubt there's 3 particular DHBs which have been struggling. That impact on the patients is unacceptable, and plans are in place to rectify that. It's vital that we continue momentum and continue to deliver more services, and that's what I'm absolutely committed to doing as Minister of Health. Ophthalmology FSAs have increased from 45,000 8 years ago to nearly 56,000 in the past year, so that's nearly a 25% increase. And at the same time, ophthalmology discharges have gone up from 18,000 to 23,000 over the same period. So that's a 28% increase. Avastin injections have doubled from 4,000 just 5 years ago to 8,000 in the past year. But the problem is that's in the face of an over 3 times increase in demand. So while clinical prioritisation helps to ensure the right patients are treated at the right time, there are always going to be patients who do not receive treatment. We launched the National Patient Flow Project to measure the outcomes of general practice referrals to hospital specialists, and that's the first time that's been done in this country. New Zealand is one of only a few countries collecting information of that kind at a national level. The latest data is for the quarter between October and December last year, and at that stage, in that quarter, there were 160,000 referrals for an FSA, and 87% of those referrals were accepted. So there is still more to do, but I can't emphasise enough, that's what we're committed to pushing through. Developing a clear vision for the future of IT investment in health is also something we've got to work on. E-health solutions make the health system more efficient, as well as delivering better health outcomes and providing integrated care much closer to home. The health strategy provides a clear framework for the next phase of the Digital Health Work Programme 2020, and that builds on the National Health IT Plan. The Digital Health Work Programme will introduce a single electronic health record, allowing individuals to communicate their health story, presenting health information in a single view that can be seen by patients and clinicians, and it's going to mean that patients can take a much more active role in their care. It's important that the health information we collect about individuals and populations is shared across the broader social sector to inform future social investments, to evaluate the impact of programs, and to ensure the services provided by other sectors contribute to improving the health of all New Zealanders. Of course, I'm very aware of privacy issues, and that is one of the main issues which we are looking to tackle as a group of ministers. For information sharing and integrated services to work well, it's going to take a team approach. They need to be developed and implemented with strong leadership from clinicians, working in partnership with patients and vendors. Now, I mentioned earlier in my speech the National Telehealth Service, and that's another good example of the potential of e-health solutions. That service was launched in November of last year and is available 24/7, 365 days a year, and can be reached through a range of channels. It's fair to say it's the world's first integrated platform providing seamless support and advice. It brings together 7 helplines: Healthline, Quitline, Gambling Helpline, Alcohol and Drug Helpline, the Depression Helpline, and the Poisons and Immunisations Advice Services. In its first year, the National Telehealth Service has helped 425,000 New Zealanders via over 550,000 contacts to the service. That's 1 every minute, and that's 1 in 10 New Zealanders accessing the service over that time. So in closing, I believe the health system is tracking well. New Zealanders are accessing better services, but from time to time, as we've seen in the case of ophthalmology, those services aren't performing at high enough level, and we've got to address those issues as quickly as possible. I believe in the health workforce team concept, from the ministry to senior specialists, to people working in allied health professions, to people working as receptionists, to the governance arm, to the executives. Everyone involved in the health system is working to deliver better health services for the whole country. I want to reiterate that as Health Minister, I and my colleagues remain focused on continuing to increase access to more health services. And I believe that commitment is going to be reflected again in next year's budget. So I want to thank you for the work that you are doing, and I really appreciate the opportunity to talk with you today, and I'm looking forward to your questions. So kia ora and all the best. Thank you.